In Tameside and Glossop, the Primary Care Trust doesn't just meet NICE guidelines, it exceeds them, providing patients with choice, accessibility and convenience.
We're going to feel for pulses now on your feet.
NHS Tameside and Glossop has set up the first primary care vascular assessment service in the country. Following NICE guidelines, patients with diabetes have their annual foot assessment. But if there's a problem, patients can come to the clinic for vascular testing rather than going to hospital.
It's a local service that we offer. We're quite unique, really. A lot of other PCTs have to refer up to the acute trust. We offer, like I say, a local service. Patients can come to, it's near the home. They know the clinic that they're going to. It's not as scary as going up to the acute hospital.
With the vascular testing service, NHS Tameside and Glossop are exceeding NICE guidelines, providing more choice for patients and tackling serious health problems in their area.
Vascular testing like this means conditions can be picked up early, the patient can be treated quickly and they're less likely to need an amputation.
NHS Tameside and Glossop also uses the same principles in its Here and Now service. Working in partnership with the United Co-op Healthcare Group, it's providing advanced digital hearing aids to patients quickly and in a local community setting, and that means care closer to home. The pilot scheme has been so successful, the Primary Care Trust is now hoping to expand the service to other clinics.
OK, yeah, there's a little bit of wax there, so we'll get rid of that.
Thanks to the new Here and Now service, patients with hearing difficulties are assessed by a nurse within 2 weeks of a GP's referral, with most being seen within 5 days.
So I think for the patients it's a seamless service, there's very little wait. They're informed every step of the way about what's happening and the timescales involved. And we've tended to overestimate rather than underestimate, so really the service as it's gone along has speeded up, you know, and they've got their hearing aids very quickly.
What I need to do is put a little foam block in your ear.
After seeing the nurse, the patient is then assessed by an audiologist. Thanks to the Here and Now service, it takes just 6 weeks for adults to be fitted with a hearing aid, all without needing to visit the hospital.
Excellent, very good, very quick. Because normally you have to wait quite a while for these appointments.
Both the vascular service and the Here and Now system are hugely popular with patients.
These services are really beneficial because we're providing them in what is a non-medicalised setting. We're providing them across a range of settings so people have a choice of where they want to go. They're fast, they're convenient and they're very personable. And by doing it in this way, providing services very locally by very energised staff, we're not only able to meet NICE guidelines, but we're able to exceed them.
NHS Tameside and Glossop are going above and beyond expectations, making sure patients receive the very best clinical care.